Hey guys, today we're going to be doing something a little bit different, and that's going through your questions and suggested topics that you've submitted through the Instagram page. So first topic is wide set breasts with implants. So when we're talking about wide set breasts naturally, typically that means not only is the breast tissue set far apart from the center, but the nipple is as well. When we put breast implants in, we have to center them behind the nipple in most cases. And what that's going to result in is a space between the breasts that's quite wide. I get a lot of patients coming through the office. They say they don't want that wide gap that they've seen on the internet. They want closer cleavage. And the way to get that is twofold. First of all, you need an implant that's wide enough to fill your breast footprint. Now, if you imagine we put an implant in close together so you get very good cleavage, but your breasts are naturally set far apart, your nipples will be out the side. And that's another thing that a lot of people come in and say they don't want. They don't want the nipples that are pointing in opposite directions. So the only way to really get that forward-facing nipple with naturally wide set breasts is to also move the nipple. And so there is a procedure where we have to cut around the areola. So you end up with two scars. You'll have a scar under the breast where the implant goes, and another scar around the areola where we've moved it towards the center of the chest. That's the basic principle of dealing with that. All right, let's move on. Next question or topic is revisions, complications, reasons for revisions, what happens during revision surgery. That's a huge topic, and I'm actually going to do a video all about revision surgery and potential complications later on. Someone's asked about exercise. Now, with exercise, we do have a special video coming up with our PT, but I will say the basics of exercise are that you are not to do anything regarding the upper body in the first 6 weeks after the surgery. And I've discussed that already very briefly in my other video about why you should wear your post-op bra. But we'll get into those details with our PT. Okay, someone's asked about revisions or lifts when you already have implants. So this is a fairly common thing that I see. A lot of women that have had implants years ago and then have gone on to have kids and breastfeed, they have a little bit of their own breast tissue which has become saggy, and it hangs off of the implant. The easiest way to deal with this is simply to perform a lift over the implant, as long as the implants are still in good shape, still in good position. Now, if you're getting up to that, over 10-year time frame with those implants, the best thing to do there would probably be replace those implants as well as perform a lift. But that's a very common surgery that I do. Okay, tuberous breasts. So this is another pretty common thing that people come in and asking about. There are several stages of tuberous breast that are probably best shown with a diagram, and I'll do a larger video on this later. But again, the principle of a tuberous breast is to expand the lower part of the breast. What usually happens with a tuberous breast is you get constriction, first of the lower portion of the breast, so that when women are looking down, it looks kind of like a triangle shape. More severe tuberous breast ends up with constriction all the way around the areola, resulting in a very puffy areola where some of their breast glandular tissue has herniated through, and that's what creates that puffy look. So principles of treatment of tuberous breast: expansion of the skin, and that's with an implant or a tissue expander, and rearrangement of the breast glandular tissue. So again, this is a surgery where you're going to have multiple scars on the breast, underneath where you go in to put the implant in, and around the areola where you've rearranged that tissue. Okay, someone's asked about ALCL facts. ALCL is anaplastic large cell lymphoma, and this is a very rare type of cancer that has been in the media quite a bit in the recent months and all of last year. Now, this, I guess the most important thing about ALCL is you have to know it's not a breast cancer. It's actually a type of lymphoma, a type of non-Hodgkin's lymphoma. It is not the same as primary breast cancer, that when people say breast cancer, that's what they're talking about. This cancer, ALCL, is associated with breast implants, and it is associated with more highly textured shells of the implants. So when you think about different implant shells, you have smooth, nano-textured, micro-textured, macro-textured, polyurethane. That's going from smoothest to roughest, and the more roughness of the surface of the implant, the higher risk of ALCL there is. That's not to say that the implant shell is the only thing that's going to cause this cancer. There are multiple factors, including genetic predisposition, bacterial contamination of the implant and resulting inflammation, and time. So it's something that happens very late, anywhere from 7 to 14 years after the surgery usually. And what you're looking for is typically swelling in the breast, which is fluid. If that happens, what we usually will do is send you for an ultrasound. That fluid, some of it will get taken off and sent away for testing, and that's how ALCL is diagnosed. So just because you have fluid swelling in the breast doesn't mean you have ALCL, but it is one of the early signs, and it means that we have to investigate. Now, ALCL is also curable in the early stages as long as we catch it early. We have to remove the implant and the capsule completely, which contains the cancer. So again, this is a very large topic that's developing as people are researching this cancer. So we'll have more information about this as it comes, but that's what we know for now based on the TGA and FDA advice. People with rough textured implants are not to remove them. They don't need to remove them unless there are symptoms of ALCL. 550cc recovery advice, the do's and don'ts. I won't make this specific to 550cc implants because it really is much the same for all implants. Recovery advice, just take it easy. Listen to your surgeon, read your post-op instructions. Next, congenital symmastia. This is an interesting topic. So, symmastia, most of you would know as uniboob, and this is where the two breasts are connected in the middle, so you don't really have a sharply defined cleavage. Now, this can happen either as a result of breast augmentation surgery, where your surgeon has dissected a bit too far and connected the breast, which is probably the most common cause, or congenital, which is what the user here has asked for. Congenital is when you're born with that condition. So I think personally, congenital symmastia is a little bit harder to correct than symmastia caused by surgery. And the reason for that is you don't have internal tissues, internal capsular tissues to use to create that defined plane. Typically, what needs to happen is a combination of liposuction through the center of the chest to really thin out that tissue, and then internal sutures. I like to use the barbed sutures, which, so you'll see it's like a suture material with lots of little hooks on it. And I like to use that internally to create the contour that's nice and defined in combination with liposuction to thin out the tissue. Breast lift. What are the different types of lifts and the scarring? So there are a number of different types or techniques to lift the breast. From least invasive to most invasive, you have the crescent lift, and what that results in is a small semicircular scar above the areola that literally just lifts the nipple. I wouldn't call that a full breast lift, as it is not strong enough to lift the breast tissue. The next one is called the Benelli or donut lift, and this one, the scar goes all the way around the areola. So this is a little bit more common than the crescent, and again is used to reposition the nipple on the center of the breast and can also lift a little bit of the breast tissue. The third type is called the lollipop lift, and so there you have the scar around the areola and a vertical line down. Again, this will lift the nipple and lift a little bit of breast tissue, but not as much as the full breast lift, which results in the anchor scar, So the anchor is around the areola, vertical line down, and a horizontal line underneath. And when I do mastopexies or breast lifts, this is probably the most common way that I do it for the patients that I see. The different techniques can result in different looks, and what I'm seeing the trend these days is for a very high breast and tight breast, and so in order to get that, you do need to do the full lift with the anchor scar. My practice nowadays, I don't even really do the crescent lift anymore. It's either the Benelli or the anchor. Okay, next, pocket tightening surgery for implant displacement and to optimize results. So once a woman has had breast implants, the implants form a healthy layer of scar tissue around them called the capsule. And within the capsule, that's called the implant pocket where the implant sits. Now, over time, those implants with physical activity and just time can move around and make that pocket larger. When that happens, the implants can start to move and either flip or become displaced laterally or inferiorly. And that is fixable. In order to do that, we have to go in and make that pocket smaller again, more like it was at the time of the original surgery. So very much like in symmastia, I like to use a barbed suture with all the little hooks on it in order to provide very strong purchase internally to make that pocket smaller and squeeze the implant a bit tighter so it doesn't move and doesn't flip anymore. Now, when we do that, there is always a risk that the pocket can stretch again, but with those barbed sutures, the chances are very low. Okay, this person says, "Hi, Dr. Chinsee." Hi. Next question, different types of implants, your recommendations and why. Now this is a huge topic because there are lots of different styles of implants, different companies and brands that produce the implants, different implant shells, different gel thicknesses. So I'm gonna do another video devoted just to implant types, and we're gonna go through all of that information. Okay, and that's it for the Instagram questions today. So guys, again, if you like what you see, please like and subscribe, and I'll see you next time. And so that ends up, oh, of course. Thanks, right? That's great.